Hey guys, it's Dr. Childs. Today we're going to be talking about Graves' disease, but specifically how to eat when you have hyperthyroidism. And this is a topic I get asked about frequently, and I think it has to do with the fact that there's a lot of confusion surrounding hyperthyroidism, Graves' disease, and specifically why a lot of patients who have this condition end up overweight, right? Because that doesn't make a lot of sense. Most people consider having too much thyroid hormone in your body will result in weight loss, and that is true. But there's some things we need to talk about here, which will elaborate on why and which foods you need to eat if you have Graves or hyperthyroidism. So let's start with this: can you cure Graves? And the answer is I don't want to say that it's curable, but what I want to say is that you can usually, if you're aggressive enough, reduce the symptoms or reduce the amount of antibodies floating around in your blood. Not with everybody, but with some people you can. And a lot of this can be mediated through diet, and so that's why this is really important here. So let's talk about it. But first of all, Graves' disease is an autoimmune disease, which you're probably aware of. But what ends up happening here is that your body creates antibodies that latch on to your thyroid gland, and instead of damaging it like it does in Hashimoto's, it actually causes the thyroid to produce more thyroid hormone. And so that's the pathology behind what is occurring in Graves. Now, I want you to remember this, because what the way that this occurs usually stems from a couple of different areas in the body, and we'll talk about that specifically in just a moment. But first, I want to say what is happening, so that the symptoms related to this auto antibody attack on your thyroid gland. So what happens when these antibodies sit on the thyroid gland? They cause the production of thyroid hormone, and that results in the symptoms of hyperthyroidism. Okay, so the autoimmune component of Graves sits on the thyroid gland, produces the thyroid antibody in excess of what is normal, or thyroid hormone in excess of what is normal, which results in the symptoms of hyperthyroidism. And those symptoms include anxiety or mood changes, heart palpitations and rapid heart rate, weight loss usually, but usually followed by rapid weight gain following treatment, and that's the key here. Hot flashes or heat intolerance, reduction in energy levels or fatigue, and then insomnia and or difficulty sleeping. So those are the symptoms of hyperthyroidism when it is active, and that's really important. We'll talk about that in just a minute. So why then, when we take a step back and look at that, look at the pathology from start to finish, we know that something is happening to cause the antibodies. Then we know the antibodies are sitting on the thyroid gland, causing excessive thyroid hormone production, and then we know you get the symptoms. So what we need to do is we need to look at that from a bird's eye view and address the antibody portion. So why is your body creating the antibodies to begin with? And that's why we're going to talk about a couple areas here. And the first is the gluten and Graves connection. And so many studies have shown that patients with celiac disease are significantly more likely to present with Hashimoto's thyroiditis, which is another thyroid autoimmune disease, and or Graves' disease. And both of these can be can occur at the same time, actually, which can be very confusing for a lot of patients. But just so you know, there's a connection between the autoimmune disease of celiac, which is gluten autoimmune disease, and both autoimmune disease of the thyroid. Now, what gets interesting is that a lot of the standard therapy for somebody who presents with Graves' disease or hyperthyroidism is simply to just treat the problem. So and what I mean by that is to treat the problem as it relates to thyroid function, right? So instead of going to the cause of the antibodies, what they do is they skip that step and they just say, okay, well, let's block thyroid function, right? So let's skip the first step and go to the second step in that pathology that we talked about from the bird's eye view to see if we can have an effect. And of course you do, but you're not treating the root cause of the problem. Now, this is important because many patients with celiac disease, and by the way, celiac disease may be the cause of your antibodies, okay? So just to put that in perspective. So that's why it's important to identify. Now, many patients with hyperthyroidism present with what's called silent celiac disease, meaning they don't have any intestinal symptoms related to their disease, which is huge, right? Because your doctor may may look at you when you present and say, well, you have hyperthyroidism, you probably have Graves, and they may or may not check for those antibodies to confirm that. And instead what they're going to do is they're just going to say, here, take this thyroid blocking medication and be done with it. When in reality they should at least be diligent enough to look for the gluten antibodies, whether you have intestinal symptoms or not. And what I mean by that is the intestinal symptoms that usually occur with any sort of gluten intolerance include things like, gas, bloating, malabsorption, abdominal pain, diarrhea, things like that. But the problem is celiac disease is a systemic disease, which may manifest with things like depression, anxiety, fatigue, various symptoms related to malabsorption of nutrients and hormones, neurological changes, skin changes, rashes, things like that. And so these are all the extra intestinal manifestations of celiac disease, which means that you really need to be assessing for the antibodies relating to gluten if you are diagnosed with hyperthyroidism. Because why just hyperthyroidism? Because Graves is the most common cause of hyperthyroidism. So that's how kind of this all fits together. Now, what is happening and why treating celiac disease may improve some of your symptoms and reduce your antibodies is not, it has to do with the gluten, but more specifically, it has to do with what the inflammation inside your gut is doing to the intestinal lining. So you need to consider that your gut, the lining of your gut, the cells inside your gut, act as a protective barrier which is meant to prevent bad things from getting into your body and allow good things to get into your body so that you can absorb those. Okay, so the bad things would be things like undigested food particles, bacteria that are native to your bowel, anything like chemicals that you would consume within your food or any sort of processed food, things like that. And it wants to block those things from getting in. Now, the things it wants to let in are obviously the broken down nutrients, right? Amino acids, carbohydrates, things like that, the fat. Those need to be absorbed, and then also obviously hormones and anything else that you're consuming that needs to get into your body. You want to let those things in, but you want to block the bad things from getting in as well at the same time. Now, what happens with celiac disease is you have inflammation at the barrier, which is supposed to act as the guard. Now, when that occurs, the lining becomes less durable, so to speak. So you can kind of think of it as, instead of being like a cement wall, it now becomes sort of like a fence, one of those like chain linked fences. And so what I mean by that is things are going through it without being checked at, or without being checked. So it'll allow the bad things to come through, but it'll also allow the good things to come through as well. And that's not what we want. And so the inflammation related to celiac disease may allow for something called molecular mimicry to occur, which is basically an immune confusion in your body. It's a state of confusion as it relates to the immune cell. And what will generally happen, or what is thought to happen, is when the intestinal lining becomes leaky and holy, it puts holes inside of it, you may get undigested food particles that absorb into your bloodstream, or bacteria. It could be bacteria or blood or food particles, which then your body identifies as abnormal. It creates antibodies to it, but then the problem is some of those undigested food particles and bacteria look similar to existing parts of your body, so like your thyroid, for instance. So your body may create antibodies to the bad thing that comes in, but that thing just happens to look a lot like your thyroid. And so you get this molecular mimicry, which means that the antibodies are attacking the bad thing that just came through, but the casualty of all this is also your thyroid gland. So the idea is that if you reduce the inflammation locally, then you can reduce the production of these antibodies and at least reduce the attack on your thyroid gland. That's how this is supposed to work. But you also get several other benefits that even if you don't reduce your antibodies, you still might get other benefits, and those include increase in the absorption of nutrients, right, because you're healing that intestinal wall, increased absorption of medications like thyroid hormone. Again, this is all good. If there's inflammation, it's not going to do its job effectively. It may reduce the levels of systemic inflammation, but certainly local inflammation. It may improve intestinal permeability, which is, you might know this as leaky gut. And then it also might reduce the production in autoantibodies in certain people and conditions. So it's really, really, really important to assess for this if you have Graves or hyperthyroidism. And you can do this very easily. You can do this by checking for tissue transglutaminase. That should not be a G there. That needs to be a tissue transglutaminase. So you can see it down here. And then also gliadin peptide antibody. Again, these are very simple tests that your doctor should know about. And I've given you an example of what it looks like when it is elevated. The second thing is, I usually recommend that if you have Graves' disease, that you get assessed for food sensitivities. And the reason is simple. The same process that we just described with gluten and celiac disease can occur if you have food sensitivities. So think of food sensitivities not like true food allergies, but more of a intolerance to certain foods, which results in intestinal inflammation when you consume it. So the same process is occurring when you have food intolerances, and that results in basically the putting of holes inside of that intestinal lining, or making or causing leaky gut, if you will. The idea, though, is you need to get the proper testing to assess for these food intolerances and remove those. So this is kind of how we're transitioning to what you should actually be eating if you have Graves. And you could read more about the type of testing that I'm talking about in this post if you want, but I'll just explain it briefly for a second. So the idea is that the right test that you need to get is called a delayed IgG food sensitivity test. And this is actually assessing for IgG antibodies to certain food groups. And then it's very simple. Once you know what you're reacting to, you remove those foods, and then you go from there. So the two things, if you have Graves, that you want to do is you want to assess for gluten or celiac disease by assessing for those gluten antibodies, and you want to assess for any food intolerances. So and we're going to talk specifically about what you should be eating in just a second here, but I wanted to explain that. Now, the next question is, does Graves cause weight loss or weight gain? And in order to discuss this, we really need to talk about at what stage you are in treatment, because that matters a lot. So if you're in the active stage of hyperthyroidism, then that means that your body is actively producing antibodies. You are actively in a state of excessive hormone production in your body. And when you are in that state, things are different, okay? And this state needs to be differentiated from the treatment phase of hyperthyroidism. So when you are actually, the diet guide that I'm about to talk about is when you are in the state of active hyperthyroidism, meaning that you actively have a suppressed TSH, your free T3 is high, your antibodies are high. It is not when you are on thyroid blocking medications, or your thyroid has been removed, or you've undergone radioactive iodine ablation. Because basically what happens is the treatment of Graves' disease or hyperthyroidism results in hypothyroidism. Okay, it is going to reduce the thyroid function in your body, and that changes everything that we need to talk about. So what will happen for most patients is that they will experience some brief weight loss initially when they get diagnosed, and that will be followed by weight gain once they undergo treatment. So the idea for us is we want to catch you when you're in the beginning stages before you've had that treatment. And the permanent treatments would be things like thyroidectomy or radioactive iodine ablation. Once you've had that done, a lot of what we're talking about here is not helpful for you. You need to look into hypothyroidism treatments. But the point is, most patients with Graves and hyperthyroidism will end up long-term with a lot of weight gain, and that's because of the treatment. Okay. Now the weight loss will occur, but that as a result of the hyperthyroidism. And I've shown some studies here that show that, again, the majority of patients with hyperthyroidism actually do end up gaining weight long term. So let's talk about what you should actually eat if you have hyperthyroidism. So first of all, I've given you a list of vegetables. Obviously, you want to have organic whenever possible. You can read through these. There's a set of fruits here, organic when possible, that you can read through here. These are all approved and safe to eat. There's some proteins that I've included here as well, and then obviously fats, and these should all be cold pressed. So I'm not going to go over all these because you can easily read them and go back to this post and look those over. I will talk about some general guidelines of things that you want to be following though. So first of all, I do recommend that you avoid gluten. And these are all going to be things that you should be avoiding because this will help with your hyperthyroidism long term. So number 1 is gluten. Number 2 is dairy products. Now I do recommend you remove dairy products for at least 60 days. The reason is because a lot of people are intolerant to them, especially if they have gluten intolerance or food sensitivities. Your intestinal lining just becomes very sensitive. The next one is refined carbohydrate like breads, things like that. Those will be removed anyway if you remove gluten, but they're worth mentioning. You want to also be removing any sort of inflammatory fat or industrial seed oils. The reason is because these will cause some inflammation in the body. And it will make worse any existing local inflammation that exists in your GI tract, and it may cause high CRP, high ESR systemically as well. You want to also be removing or avoiding any processed foods with preservatives. So you want to, if you're looking at the back of a label and it has ingredients that you can't pronounce, you want to get rid of it, right? You just don't want to be eating stuff like that. You also want to be avoiding alcohol and then, of course, sugar. So if you combine these, if you avoid this stuff and you eat these things, you'll be doing a lot for your body. This can be done without even checking for celiac disease or without checking for food sensitivities. But a lot of these things will be helpful right off the bat. Now, it might not be sufficient to completely remove everything or to reduce your antibodies to zero, but it will. There's a good chance that it will at least help you symptomatically. So, again, now if you remember previously, I mentioned that there's a difference between hyperthyroid patients who have gone through thyroidectomy and RAI and those who are actively being treated with just something like methimazole. And so if you have undergone if you're post-thyroidectomy or if you're post-radioactive iodine ablation, then you currently have hypothyroidism and you need to eat a little bit differently. So I only mention that because you're going to want to check on this post, which is the link is down here, and this will go through the hypothyroidism diet guide. Because again, you had hyperthyroidism, right? But the treatment of your hypothyroidism in Graves made you hypothyroid. Okay, and so that's why this is important. The other thing is you probably want to also couple any dietary changes with some specific supplements that will help you do a couple things. So number one, you want to take supplements to help promote normal intestinal health. You want to take supplements to cool down any inflammation in your body, and you want to take supplements to improve and ease your immune function. Okay, so let's just talk about those really briefly because these can all be synergistically combined with any dietary changes that you actually make. So the first would be probiotics, and you're specifically going to want a high dose. Now, probiotics are very helpful because they can help normalize intestinal microflora, they can reduce inflammation, and they may even promote or change caloric absorption, so which is a good thing actually. If you want to take, you can see the recommended brands of probiotics that I have here by clicking these links, but probiotics are a big deal. The next thing would be L-glutamine plus DGL. So L-glutamine is a very important nutrient as it relates to the building up of the intestinal lining inside of the GI tract. So if there's any sort of intestinal inflammation, you're going to want to be using L-glutamine to help rebuild up the structural integrity of the lining of your GI tract. So that's why it's very helpful. And DGL kind of just helps everything, helps soothe inflammation locally and helps reduce that local inflammation. Next one would be pepsin plus HCl. And the reason for that is because low stomach acid may lead to reduction in nutrients and things like that, and also may reduce immune function. So if you take pepsin and HCl together, they will actually help you absorb more of the food and the nutrients that you're consuming, which will ultimately help you long term. Now, those are all supplements to help with your GI tract. The next area we want to talk about supplements to cool down inflammation, right? Because that's another very important aspect of fixing Graves' disease. You can do that through diet, but you can also augment whatever you're doing with your diet by taking certain supplements. The first would be fish oil. Fish oil naturally helps reduce systemic inflammation. It also helps to balance the omega-3/6 to fatty acid ratio, and it can actually help with weight loss and increased skeletal muscle mass. It has a whole bunch of other beneficial effects. You can check out the benefits of all of that in different studies here. I talk about this extensively over here. But the point is there's lots of other benefits to fish oil aside from the reduction in inflammation. Next supplement on that list would be alpha lipoic acid. So this is, again, a very, very potent anti-inflammatory agent, which also reduces blood sugar, reduces systemic inflammatory markers, and helps with weight loss. Again, if you want to read more about alpha lipoic acid, you can read this article there. And then quercetin with bromelain. Quercetin is, again, another thing that reduces inflammation, and it can also help improve immune function and improve the GI tract as well by helping with absorption. So I recommend if you're going to be using these to cool down inflammation, you probably want to take at least 2 of these 3 together. And then lastly, the second kind of huge area that you want to be addressing to improve your Graves or hyperthyroidism is using supplements to ease immune function. So first would be zinc, and that specifically zinc picolinate or zinc bound to picolinic acid. The reason for that is that has the best and most superior absorption of all the zinc formulations. But basically, zinc is very important for, it plays a very important role in the immune regulation or immune function just in general. It also happens to be anti-inflammatory and acts as an antioxidant. And a lot of people are deficient in zinc. So I do recommend that if you've never taken zinc before, there's a good chance you're zinc deficient. Next one would be selenium. So selenium also improves thyroid function. It can also directly reduce thyroid antibodies by itself. And so it's required for naturally for the immune function as well. And so it's another beneficial nutrient to take. And then the last one is vitamin D3 and K2. So I always just recommend you take K2 with D3, but specifically we're talking about D3 here. The reason for that is studies have shown a clear association between autoimmune disease generation, and low vitamin D levels. And I can tell you from experience that I don't know that I've ever seen anybody with a normal vitamin D level in just testing it. People just they wear the clothes out in the sun, or they avoid the best time of the day for the sun for numbers of reasons related to diet, etc. They just do not get adequate vitamin D levels. So checking and assessing your vitamin D and taking it if necessary will be beneficial for your immune function long term. And that's pretty much it, guys. So we have a lot that we discuss here, and it's kind of a complex topic, and that's why I spent a lot of time on this. So the point is, if you have hyperthyroidism or Graves, you need to assess. You need to look for gluten intolerance or celiac disease. You need to also be assessing for food sensitivities, and then you need to put that into a structured dietary list of foods that you can eat while avoiding other foods that will negatively impact inflammation of your GI tract. And if you do these things, it might be beneficial, and it may result in a reduction of inflammation systemically, but also locally in the GI tract, which may reduce the amount of antibodies produced and which are attacking your thyroid gland. Now, remember, this needs to be hyperthyroidism that isn't treated is different from hyperthyroidism that has, if you've undergone thyroidectomy or radioactive iodine ablation. So just remember, these are two separate things and they need to be treated differently. So that's it, guys. If you have any questions about this, let me know. Leave them in the comments below. If you want to see the rest of the information on this this post, you can do that. All the relevant links and everything that we discussed are here as well. So otherwise, I'll see you guys in the next video.